This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
3 words that paralyze us. You have cancer. But unfortunately, roughly 2 million people in this country will be diagnosed with cancer this year. And one of the most common cancers is colon cancer. Today, we look at why colorectal cancer is on the rise in America. Why are we seeing higher rates in younger people than ever before? And why are young men so susceptible? Who is most at risk? What are the risk factors? And what lifestyle changes can be made to lower your risk? All questions we will answer. Plus, did you know the recommended age for a colonoscopy is now younger? If you're 45, it's time to get screened. And if you don't want to go in for a colonoscopy, we'll tell you how to test at home. Today's information may save your life or the life of someone you love. So stick around for your prescription for life when it comes to colon cancer. Hi, and welcome to Prescription for Life. I'm Monica Robbins, and this is the Health and Wellness Show where we tackle the topics of some of your biggest health issues. And for a growing number of people, that's colorectal cancer. It's the 3rd most diagnosed cancer in both men and women, and it's the 2nd leading cause of cancer death. We are seeing a drop in the number of people over 65 getting diagnosed with colon cancer, but more concerning is the rise in people under 50 being diagnosed. In fact, 1 in 23 men and 1 in 25 women will be diagnosed with colorectal cancer in their lifetime. We will talk to our expert about all of this in just a moment, but first, this report from Kimberly Davis of our Houston station, KHOU.
I was diagnosed with adenocarcinoma of the colon, so colon cancer.
It's certainly not the diagnosis anyone expects, especially at such a young age. Jonathan Bialis is only 28 years old. He tells me it all started with a pain in his abdomen in the middle of the night.
That just kept getting worse and worse and worse until eventually I had to go to the emergency room. They told me I had diverticulitis, which is, for those people who don't know, it's like a pocket in your intestines. They thought it became inflamed.
After a visit with a gastroenterologist and a colonoscopy procedure later, doctors found a tumor wrapped around Jonathan's colon. A biopsy showed it was cancerous, stage 3.
He is 28 years old. He is a very young patient. Unfortunately, it's something that we're seeing not uncommonly.
Dr. Marianne Cusick says it's a trend that started over the last 8 to 10 years. Right now, it's unclear what's causing young people to develop colon cancer.
There's about a 1 in 3 chance that unfortunately, I'm not gonna make it 5 years, which is, it puts life in perspective when you hear people talk about how awful it is getting older, and I just really wish I could make it to 35.
Jonathan is doing what he can to increase his chances of survival. Before his diagnosis, Jonathan was once a heavy smoker and moderate drinker. He's also lost weight and changed his diet.
Jonathan's cancer had already spread, so it wasn't just involved in the colon. It had started to be on the move. It had started to be in the lymph nodes. It had not reached the blood supply or other organs yet, and that definitely changes the survival rate.
Dr. Cusick says Jonathan will begin chemotherapy soon, which will increase his survival. He just needs to be monitored more closely.
But it happened to me, it can happen to anyone. I mean, people like to think of cancer as, how to put it, an old people disease, but it's not.
For more information on this story and our series with UT physicians, head over to khou.com/health matters. For KHOU 11, I'm Kimberly Davis.
Now let's get some of your questions answered. To do that, I talked with a colorectal surgeon from Cleveland Clinic. Take a look. Joining us now is Dr. David Liska, a colorectal cancer surgeon at Cleveland Clinic. Thank you so much for being here.
Thanks so much for having me.
We're talking colorectal cancer. Explain what it is, because I think a lot of people are still kind of confused as to what it means.
So colorectal cancer is a cancer that affects the large intestine. Large intestine is another word for the colon and rectum. So colorectal cancer is a cancer that either affects the colon, which is the first part of the large intestine, or the rectum, which is the last part of the large intestine.
So how does it start?
Yeah, so colon cancer usually starts as a polyp. So they start as very small growths within the lining. It comes from the lining of the intestine. And over time, over many years, these polyps get larger. They accumulate more mutations until they turn into a cancer.
So is somebody more at risk? Like, is it you have to have a genetic connection to this, or can you get it through lifestyle? How does a polyp happen?
Right, so it's multifactorial. There are many different reasons why people develop cancers. There can be genetic predispositions to colorectal cancer, but most cancers are not due to genetic hereditary conditions. Most cancers are sporadic, meaning they happen in people who don't have a syndrome, and they happen due to a combination of some genes, but also due to environmental exposures.
When you talk environmental exposures, are we talking just food?
No, not necessarily. Food is definitely a big factor, but smoking is a known risk factor for colorectal cancer. In certain foods, more so than others, we've seen that people who don't exercise, or people who have sedentary lifestyles, and people who drink a lot of alcohol are also at higher risk. So yes, it's foods, but also other environmental exposures as well.
If you were to tell your patients there's one food you must avoid, what would it be?
Probably red meat and deli meat. Those are the two sort of types of meats that have been found to be associated with colorectal cancer the most.
And is it because of the nitrates in the deli meat, or what?
Yeah, probably some of the preservatives in the deli meat. Hot dogs also increase the risk, so it might be the nitrites, the preservatives in those foods, but also regular red meat as well has been shown. So it's not that you can't have any, but having too much of it can definitely increase the risk for colorectal cancer.
So one of the things we're seeing, though, is that we're seeing more cases of colorectal cancer on the rise in younger people. We just saw the actor Chadwick Boseman had it. There was another actor who just announced who has it. Why is this affecting younger people?
Yeah, that's an excellent point. And colorectal cancer as a whole, we see the incidence and mortality is going down, actually. However, what we are seeing more recently is that in young people, the incidence is climbing and climbing at alarming rates. And we really need to figure out why. The answer, we don't have the answer exactly yet, but it is paralleling certain other epidemiological factors that we're seeing, such as the rise in obesity in young people, right? We're seeing that more and more Americans are overweight or obese, and we think that that is at least partially related, but there probably are other environmental factors as well that are driving this rising incidence, and we need to figure out exactly what it is so that we can prevent it.
Any idea what those environmental factors are? Are you talking pollution, that kind of thing?
Yeah, we're looking into it. Many different researchers are looking at trying to figure out what these different factors are. You know, definitely it could be other things in the food. It could be pollution-related items. It could be related to the microbiome or the sort of bacteria that live in our gut, and certain things that we do that affect that microbiome, such as exposure to antibiotics at an early age. So there are many different factors that people are looking at to figure this out, so that we get a better understanding of it.
So who's most at risk, men or women?
It's pretty similar, actually, both men and women. In the young people, we see a slightly higher risk among women, but both men and women we see a rising incidence in young people.
And what about races, ethnicities? Does that come into play?
Yeah, absolutely. There are big disparities in colorectal cancer as a whole, racial disparities, and we know that non-Hispanic blacks, American Indians, Alaska Natives are at very high risk for colorectal cancer in general. Within the sort of rise in young people, we actually have seen that the rise is more pronounced in white people. So even though overall colorectal cancer is definitely an overrepresented problem in minorities, the increase we are seeing is very pronounced in white people as well.
You mentioned polyps. Do people get symptoms? Can you know if something isn't quite right?
Right. Yeah, so symptoms are an important factor, especially in the young, because young people, you know, if they're younger than 45, they're below the age for screening tests. So the only real know for people to find out that they have something is through symptoms. So symptoms are an important thing to pay attention to. Now, polyps, especially small polyps, often won't have any symptoms. Even cancers, when they're still small might not have symptoms, but one of the common symptoms we see, especially in young people, because in young people, the colon cancers are more commonly near the rectum or on the left side of the colon. Many of them do present with bleeding as a common symptom, where you either have, blood in your stool or blood coming out of your rectum that you can notice, and that's something that should not be ignored.
When you say blood in your stool, we often hear there's bright red blood, there's dark. Is there something I should be looking for?
Yeah, any blood it shouldn't be there. Okay, it's not normal to have blood in your stool that dark or bright red. When we say bright red, we're thinking that it's more distal, coming sort of closer to the rectum. So again, that's why it's more apparent, the bright red. If it's darker, some people don't notice it as much, and that's usually more related to a more upstream type of bleed. But any blood is not normal and warrants a discussion with your physician.
So if you don't qualify for a baseline colonoscopy, which is I would assume the only way to find out if you're dealing with something like this, or it's a preventative, correct?
Correct. So colonoscopies are both a diagnostic and a preventative tool. And most cancers we don't have any preventative tools, but colorectal cancer is something where we actually have a tool that can prevent cancer by doing a colonoscopy, finding a polyp, and then snipping the polyp off before it has a chance to turn into a cancer. So colonoscopy is both diagnostic and preventative. There are other screening tests that are more diagnostic tools, such as tests that detect abnormal DNA or blood in your stool. Usually those are tests that are better at detecting cancers than at preventing cancers. But if you can detect a cancer while it's still at an early stage, it's very treatable and in most cases curable. And that's why it's so important to do some sort of screening test when you reach the right age, so that cancers can be detected, treated early, ideally prevented, but if not prevented, at least caught early so it can be cured.
The tests you're referring to, are those the ones you can do at home?
Right, so stool-based tests can all be done at home, and those are very easy to do. Like I said, they're diagnostic tools. They are not treatments, and usually most of these diagnostic tests will require a confirmatory colonoscopy. So if you do one of these at-home tests and it comes back positive, it doesn't mean you have a cancer. It just means the test was positive and that you need to have a colonoscopy to confirm the findings.
So who should be getting these at-home tests then?
So the screening tests start now, the recommendation is to start at age 45. So these tests are not for people with symptoms. If you have a symptom, if you have blood in your stool, you should have a colonoscopy. These tests are meant for people who reach the age of screening, either age 45, usually that's for average risk individuals, and those people then can either do a colonoscopy or do one of these other screening tests to see if they should have a colonoscopy.
A lot of people are afraid of colonoscopy. I will admit I've had 3, and the prep is always the worst than the actual procedure. What do you want people to understand about this particular procedure?
So I think what you just mentioned is very important. The procedure itself, even though it sounds invasive, most people, once they have it, will say that it was extremely easy, the procedure itself, because you're either completely anesthetized or very deeply sedated. So you shouldn't have any pain during a colonoscopy. The preparation is not fun to do. There are easier types of preparation nowadays, lower volume that you have to drink, but they're not as bad as people think. That's what most people tell me who have had the colonoscopy, that yes, it wasn't fun to do the preparation, but the procedure itself is quite easy. And usually if the colonoscopy is negative, you're good for another 10 years until you need to have the next one.
Has colonoscopy changed in the past few years?
Yes, from the provider doing the procedure, the technology has gotten better. We are detecting more and more in smaller polyps. We have better techniques at removing polyps, meaning even large polyps, which in the past maybe would have required a surgery to be removed. Nowadays, we have technology to remove polyps endoscopically, meaning without any surgery, just doing the procedure itself. So we've gotten better at finding and removing precancerous lesions.
So if somebody is found with colorectal cancer, and from statistic point of view, how often are you finding it early, where the actual colonoscopy can take care of it, compared to people wait too long to come in?
Right. So most colonoscopies, we find some polyps. Polyp detection rate has gotten to the point now where probably about 50% in men where we find some polyps, and the vast majority of these polyps can be taken care of during the colonoscopy. When we find a cancer, usually we don't take care of it with the colonoscopy, but then we refer people to surgery. The majority of colon cancers are very treatable with surgery and curable with surgery, as long as they're found before they had a chance to spread to other parts of the organ. Now, the type of treatment you receive makes a big difference on how successful it is and the quality of life that results after that treatment. So it's really important, especially for rectal cancer, which is a more complicated disease, requires a multidisciplinary team, that people get taken care of at a center of excellence.
What is the most effective treatment now?
For colon cancer, the most effective treatment is surgery.
But do people have to go through radiation and chemotherapy just like other cancers?
Right. So for colon cancer, usually you start with surgery, and then some people need chemotherapy after surgery. Some people don't, depending on the stage of the cancer. For rectal cancer, very often you do start with chemotherapy and radiation first. In some cases, the chemotherapy and radiation is so effective that you don't need to have surgery, and it can just be under close surveillance. But in most cases, still, you do undergo surgery.
So is there still a risk it's going to come back if you have surgery and they remove the section of your colon where the cancer was?
Right. So it depends on the stage of the cancer. If it's removed at an early stage, many times with the surgery, you don't need to have any chemotherapy, and the risk of it coming back is very low. And if this cancer is a more advanced stage, where it has gone to the lymph nodes already, for example, then there's a higher risk of the cancer coming back, which we then treat with chemotherapy after surgery to knock that risk down even further.
We talked earlier about colorectal cancer impacting younger people at a much higher rate, and my guess is it's also a much more aggressive cancer.
Right, so that's one of the things that's alarming that we find in these young people with colorectal cancer, is that they do present at a more advanced stage. We see many young people present with a cancer where it has already spread to other sites of the body, and we think part of that reason is because they don't have screening colonoscopies in that age group, so they present with symptoms, and many times the symptoms are, attributed to other things. Many times people will see blood in their stool, and when they're young, they won't think of cancer. They'll think, oh, this is hemorrhoids, right? Most commonly, anybody has any problem in that area, they think of hemorrhoids. And, in most cases, it isn't a cancer, but in some cases it is a cancer. But because the symptoms get kind of played down and ignored, by the time the patient comes to a physician and gets diagnosed with the cancer will have had a chance to spread already. So that's why we implore people not to, brush these symptoms away and take them seriously. But we also believe that in young people, the cancer may be more aggressive inherently, that it's not just delay of presentation, but that the actual cancer might be biologically more aggressive. So we have these two factors that come into play and are probably the reason why young people present with more aggressive disease.
Because of this, is there an effort to lower the baseline screening age?
Yeah, and it has been lowered, right? It used to be just 2 years ago, the age was 50, and it has been lowered because of this rise we see in young people. It has been lowered to age 45. Lowering it any further at this point doesn't make that much sense from the overall incidence, because people need to understand majority of colon cancers are still diagnosed in older people. Yes, the trend is alarming, but most colorectal cancer is still found at an older age. So I don't want people at a young age thinking they're at extremely high risk for colorectal cancer, because that's not the case. But it is going up, and we need to understand why. And people who turn 45 should go and have their colonoscopy. People who are younger than 45 sometimes should also have a colonoscopy, depending on other risk factors, such as a family history. So that's an important thing that people should talk to their family members about. If there is a family history of colorectal cancer, many times you should have a colonoscopy at age 40 or even earlier, depending on when your relative was diagnosed. So those are conversations that people should have with their family members to know at what age they should have a colonoscopy.
Great advice. Dr. Liska, thank you so much for joining us.
Thank you so much for having me.
Doctors say if you're having symptoms, get tested. And if you're not having symptoms, still get tested. If you do have colon cancer, you want to find it early, and testing is the only way to catch it in those early stages. So which test is right for you? Reporter Christine Pei from our Seattle station has that report.
Sherry Enholm was 47 years old when she started noticing symptoms.
I was constipated, I was bloated, I was nauseous most of the time.
Cancer was the last thing on her mind.
Old men got colon cancer. It wasn't something that was even on my radar. I had no clue.
When she turned 50, her symptoms persisting, her doctor told her to take an at-home stool test, which showed signs of blood, a red flag. Her follow-up colonoscopy then revealed an egg-sized tumor in her colon.
The gastroenterologist, he looked at me and he said, "You have colon cancer." I said, "No, I don't." He said, "Yes, you do." And I just started to cry because how do I have colon cancer?
Sherry was in her 40s when doctors said she had developed colon cancer. In fact, cases diagnosed among people aged 45 to 49 are going up.
It's not entirely clear yet why that's happening. There's active research being done in that area.
Dr. John Dunn, medical director of knowledge and implementation at Kaiser Permanente, says it's why screenings matter more than ever. The CDC recommends people with average risk of colorectal cancer and no family history of it begin screening at age 45. A colonoscopy every 10 years for this age group is the standard method. Those with average risk may also take an annual at-home test, such as the fecal immunochemical test, also known as FIT, which looks for microscopic blood in your stool. Dr. Dunn says one or the other isn't better or more accurate. The point is, just do it.
The guiding principle behind recommendations for colorectal cancer screening is that the most effective test is the one that's going to get done.
That was the message at a colorectal cancer awareness event. Dr. Rachel Isaka of Fred Hutch Cancer Center points out certain groups may be more at risk.
But in the United States, we know that Black people and Native American, Alaska Native individuals are more likely to die from this disease than any other groups.
This largely due to
lack of awareness and also lack of testing.
Frankie White wants to increase awareness by sharing her experience with rectal cancer when she was only in her mid-30s.
It was sort of shocking. Usually people at that age aren't diagnosed with cancer, rectal cancer, but I was, and because I was so young, the cancer was more aggressive.
Frankie underwent surgery and chemotherapy and survived. Like Frankie, Sherry considers herself among the lucky ones and says you shouldn't feel timid about sharing what's going on in your gut.
You know, don't be embarrassed to death. It's poop. It's not, you've got to be able to talk about it. You've got to be able to advocate for yourself. If something's not right in your body and you know it, find a way to communicate that.
Preventative screenings for colorectal cancer are covered by the Affordable Care Act. Those at-home tests are about $20, and they're covered by most insurance as well. Well, that's it for this episode of Prescription for Life. We hope you learned something, and we hope you'll join us right back here next week for another episode. Until then, I'm Monica Robbins, wishing you good health.
Thank you so much for tuning into Health Yeah. Please find me on Twitter and Instagram at Monica Robbins. Like and follow my Facebook page, Monica Robbins WKYC. Find video podcasts at Monica Robbins channel on YouTube. And please subscribe. Wishing you great health and hope to see you again soon.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.